I welcome you all at this CPC as well as Awareness Week of GERD, which is celebrated worldwide. And in 2025, this week from 23rd to 29th, this is celebrated in 2025. So I welcome you all. First, I will talk about what is GERD and what are its symptoms, how will we manage, and how it is related to day-to-day life activities and how it is being approached like related to the lifestyle of the people. And after my talk, inshallah, Dr. Asif will also talk with you, followed by Professor Abbas Khatak Sahab. He is also uh, present this occasion, and as well as Professor Dr. Noshad Sahab. He is head of Department of Medicine. So basically, GERD, gastroesophageal reflux disease. This is the most common disease encountered by the gastroenterologist in their OPDs, in their clinics. You might be aware of as people come to the OPD. I will use certain Pashto words as well. Patient complaining of chizma, medaswazi yazma, khuleta ubarazi. So this is the most common complaint or symptom of GERD. One is heartburn, one is regurgitation. So this is the most commonly encountered symptom. Acha ji. It should be defined as a symptom or a complication resulting from the reflux of gastric contents into the esophagus as well as in the oral cavity, larynx, or related structures. So it is the retrograde flow. Why? Because there are many pathologies, there are many mechanisms which leads to this even because of the most common is you can say the lower esophageal sphincter pressure reduction as well as certain other factors which I will talk in detail inshallah. So you can see GERD is basically, as I told you, इसको simple हम two में divide कर सकते हैं, symptoms plus complication. ठीक है? Symptoms मैंने आपको बता दिया, जिस तरह acid जो heartburn होता है, acid regurg, complication, which is the most important for the gastroenterologist and endoscopist, that how GERD affects your mucosa of the esophagus. The complication number one is esophagitis. It may leads to stricture and it may also leads to Barrett's esophagus, which then further leads to esophageal carcinoma. So there may be GI symptoms like आप ये देख सकते हैं. These are GI symptoms related to gastrointestinal tract, and these are atypical or you can say extra GI symptom, which is related to the GERD. ENT people are also sitting here. You might have noticed chronic cough, not responding to any medication. Hoarseness. Yes. Yes, hoarseness, dysphagia or dinophagia, many things. But the common is chronic cough, which is not responding to any medication. So we just put the patient on PPI and he responds. So this is the extraesophageal complication. This slide shows the pathophysiology, that how a person experiences or how the person develops this disease, which is basically there are many factors. On the top is hiatal hernia. Second number is BMI more than 30, age more than 50, obesity, smoking, alcohol. These are the risk factors for development of GERD. So we will also talk about how lifestyle modification can change. How it can change the management plan. यानी इवन कभी कभी हम ओपीडीज में पेशेंट को ये भी बता देते हैं कि आप मेडिसिन को भूल जाओ, ठीक है, you just focus on your lifestyle improvement. If you lose weight, if you walk 30 to 40 minutes per day, if you avoid meals late at night, we usually tell the patient कि आपने रात का खाना अगर खा लिया है तो उसके 3 घंटे तक आपने सोना नहीं है, ठीक है जी. एंड यू कैन रेज द बेड एंड ऑफ द काउच और द बेड जो भी है जिसपे वो सोता है, हेड एंड 8 इंचेस तक आपने उसको ऊपर रखना है. सो दिस इज द मोस्ट common advices which we give to the patient, and it's very beneficial. Like we have seen many patients improving just on these maneuvers. Like no need of medication mostly in most cases. So basically, hiatus hernia, which is the coming of the stomach into the esophageal portion, delayed gastroemptying, esophageal any pathology which leads to delayed esophageal जो उसकी अपनी मूवमेंट्स होती है उससे भी ये हो जाता है. Also we can see that LES inappropriate, lacks LES, lower esophageal sphincter जो है अगर उसका प्रेशर कम हो जाए तो then it leads to GERD. Other causes, impaired esophageal motility. Professor Abasa will also tell that there are many diseases of the esophagus which may lead to GERD. So the basic, as far as every clinician has its own way of treating patient, but as a gastroenterologist, sir is also sitting. This is the most important, I think. This slide, like to tell the patient to improve your lifestyle activities. उसमें सबसे पहले कौन सा आता है? ठीक है, reduce the weight. ठीक है, obesity will lead to GERD and will lead to esophagitis. Then it may certainly lead to CA या Barrett's esophagus. Smoking can disturb the lower LES pressure. Physical activities. Try to encourage the patient to walk or brisk walk for 30 to 40 minutes. Okay, there are certain medications which may lead to GERD or which provoke GERD. So this is usually most common are this NSAIDs, beta agonist, and tricyclic antidepressant. So usually this is the advice we give अक्सर हम patients को कहते हैं कि आप गैर जरूरी तौर पे अपने से मेडिसिन ना लिया करें. इसकी वजह ये होती है कि certain medicine can provoke the symptoms. ठीक है? So careful about these drugs that it may lead to GERD. Chronic cough वाली एक slide है, but that I think not. So GERD, ये Dr. Asif will explain this. GERD have 3 types. This is basically NERD, erosive esophagitis, and Barrett's esophagus. So these are the phenotypic classification of GERD. These are the symptoms which we already explained. Heartburn, regurgitation. These 2 are the most common symptom encountered by the patient. Non-cardiac chest pain. We gastroenterologists and the cardiologists sometimes have a close liaison and friendship about this thing. A patient experiencing epigastric pain, so you never know. It can be cardiac as well. So on a safe side, just you have to exclude the cardiac causes of epigastric as well as central chest pain. Thank you very much for management and investigation. I would like to call Dr. Asif to come on stage and to continue this. Thank you very much.